Yeah, man. Good evening, people. Good evening. Welcome to Unscripted. Anything goes. Anything goes. Anything goes. Yeah, man. Delvin is here tonight. Delvin Sadler. Right here in the flesh. Here for you. Yeah, man. Straight up. Yeah, man. Unscripted. Anything goes. Yeah, man. Today is, what you call now? What are the name? Tuesday. Yeah, man. And I was home all day. Taking in some soccer. Yeah, the World Cup. I had a chance today to watch the World Cup today. I watched 3 matches today. Yeah, man, the first match. I will play the first match again. I will play the first match. Yeah, I forgot I will play the first match. But the match that I was interested in, yeah, was the second match. Yeah, second match. No, the last match. The Russians play. Who Russian play again? Who did Russia play again? Yeah, they play Egypt. Yes, Egypt. They played Egypt. And they totally destroyed Egypt. And the Russians, they look like a well-tuned machine right now. Yeah, the Russians look like a team to be reckoned with in this tournament. Also, what surprised me was the second game, I think it was Senegal. Senegal, the African teams are not normally an organized team. You know what I mean? They play selfish. But this Senegalian team, they actually look like a well-coached team. They have a former player on the team, and a former player coaching the team, and he has them organized and disciplined. Yeah, he have them organized and disciplined. So I like the Senegalese, approach to the game. Yeah, they play as a unit, defend as a unit, attack as a unit. Yeah. So hopefully they can go deep into the tournament. For real. They have Sadio Mane from Liverpool, yeah. And it's unfortunate that the other Liverpoolian guy, what's his name again? Salah, that plays for Egypt. This is it for him. He didn't really get to showcase his skill set like he did in Liverpool. But it's the World Cup. You have to come prepared, ready to go, ready to rock and roll. And if you're not prepared, you're going home. Yeah, man. So, good evening, people. This is Delvin. Yeah, man. Who in the room? Make us in the room now. Yeah, man. Straight up. Sharon Shepherd. Yeah, man. Big up yourself, girl. Thanks for joining Unscripted. Anything goes. Delvin, love you. My brother Nigel is here. Nigel Bennett. Big up yourself, my brother. Thanks for joining Unscripted. Anything goes. You see there? Mava Enrique. Francis, you are here. Thanks for joining Unscripted. Anything goes. Janet Smith. I love you. Yeah, man. I love you, girl. Yeah, man. Thanks for joining. Unscripted. Anything goes. Yeah, man. People, we're still in Cancer Week. Yeah, we talked about breast cancer, and yesterday we talked about what we call cervical cancer. And then today we're going to talk about ovarian cancers. And that is cancer of the ovaries. Yeah, cancers of the ovaries. So that's what we're going to talk about today. Then tomorrow we're going to talk about prostate cancer, and then testicular cancer. And then we're gonna go to a cancer that affect both male and female, and that is what they call it, colon cancer. Yeah, man, straight up. Yeah, man. Yeah, man. I love you too. I love you, girl. Yeah, man. Delvin, love you straight up from the heart. Yeah, man. Yeah, man. You're the only one. Yeah, man. You're my one and only. Love you. I'll never take another but you. Yeah, man. Straight up. Big up yourself, Audrey Johnson. I love you, girl. Yeah, man. Thanks for joining Unscripted. Anything goes. Yeah, man. Audrey, you know that you must come on the show one day and tell the people them what you do and where they can find you. Yeah, you must come on and tell the people them what you do and where they can find you. This is a shared space here. you are a talented individual and you've got things that you do, yeah, that people would be interested in. So you must come on and tell the people them. Yeah, man, you must come on and tell the people them, yeah, what your talents are, what you do, so that they can actually support you. Yeah, man. Audrey Johnson, I love you, girl. Yeah, man, thanks for joining. Yeah, man, my mouth is too sweet. Oh, yeah, I say. Yeah, it's sweet. Why? Hey, 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 hey. Yeah, man, I love you, girl. Yeah, man, I love you. I love you. Unscripted, anything goes. Yeah, man, straight up. Yeah, man. So, did you guys cook already? Yeah, you guys cook already? What did you guys cook for today? Hmm? What did you guys cook for today? Today, yeah, let's wrap a little bit before we get into the show. Let's wrap a little bit. So today, I was home today, and my son DJ Shakur, yeah, he did some what do you call thing? He put on the grill, like barbecue chicken. Yeah, he barbecued a whole bunch of chicken. Yeah, yeah. Whole bunch of chicken. Chicken up there, although everybody ate, and there's still a lot more barbecue chicken there. Yeah. So, the outside, the weather is nice. So he just he did his thing. He did his thing, And Delvin sat and I ate and I watched some soccer all day. Yeah. Yeah, man, give thanks to DJ Shakur for barbecuing the chicken. Yeah, that was very nice of you to do that. Yeah, man, straight up. Unscripted, anything goes. So what did you guys eat for dinner today? I'm sure you guys came home to a lovely meal. I hope you guys cooking a lovely meal. Yeah, I've cooked a lovely meal. Yeah, man, straight up. Yeah, man, and have nice, healthy eating after a hard day's work. Yeah, man, after a hard day's work. It's nice to come home and eat something nice, Some nice food. Straight up, unscripted, anything goes. So remember, the rules of this show is that we don't have rules here. People are freely asked to be open and honest. You're asked to actually come on the camera and you can speak freely and open. Delvin will not block you, or nor anyone else. Yeah, man, straight up. Also, if the subject matter that we're speaking about, if you're not interested in that, you can actually change the topic to talk about something that you want to speak about. And it's very rare that people do that, but I welcome it. You understand what I'm saying? Because we're not here just to appease one set of persons. We are here to appease everyone. You understand? So you might have something that's bothering you, something that you have a question that you want us to talk about. Yeah, feel free. Yeah, we take what do you call now? Ad-libbing, rebuttals. We take all of that. Here, yeah, you have that right to do that. Yeah, man, nobody will block you. You also have the right to type freely and openly. And I've never deleted anything that anyone has typed. Never. Whether it be good or bad or indifferent, I don't delete it because you know what? We want people to know that this is a free and open forum. Not everyone is not gonna like what we're discussing, or everyone is not gonna like what is being said. But if there is a positive side of it, there can also be a negative side of it. And if there is somebody types something negative, then people should have the right to also rebuttal that if they want to. So you won't find Delvin deleting any comments or I say don't say this or don't say that. No. You have the right to talk freely and openly. Open dialogue. Yeah, man, the queen has arrived. Jacinta Sadler. How you doing, my wife? I love you. Yeah, man. Thanks for joining. Unscripted, anything goes. So for you ladies, every one of you have an ovary or had an ovary. I hope. Yeah, some different ladies nowadays, You have some transgender lady. transgender ladies, they're women, but they don't have ovaries. Yeah, yeah, transgender ladies. Yeah, they're women, but they don't have what they call ovaries. Yeah, they don't have ovaries. They don't have ovaries. You know what I mean? So we have to deal with them how they should be dealt with. If they transition from a man to a woman, and they're now legally considered to be a woman, then we have to recognize that legality and call them women. Yeah. And if they're transgender, they change from the man to a woman, then they don't have ovaries. Yeah, I'm sorry about that. They don't have ovaries. So for all the ladies who were born feminine gender, that is different now. That is different. If you were born feminine gender, yeah, chances are most of you have an ovary. Yeah, most of you have an ovary. And from time to time, yeah, some of you develop what is called ovarian cancer. Yeah. Ovarian cancer. Yeah, man, big up the tall boss. Yeah, manners and respect, my brother. I love you, my brother. Thanks for joining. Unscripted, anything goes. Yeah, man, that's the tall boss there. You know, Damien Daly. Yeah, yeah. Yeah, man. Bless up yourself. Manners and respect, my brother. Thanks for joining. You know, the tall boss is my buddy, you know. Yeah, man, he's like a son. Yeah, man, real youth. I love that guy very much, man. Good guy, you know. Very positive things. He's from where I'm from there in Jamaica, you know. Shooters Hill, Garden Close, Bull Bay. All positive people around there. I don't know nobody around there that is negative. Yeah, that even one person I know around from that street there, Shooters Hill, Bull Bay, Garden Close, no one I know around there is negative. Yeah, it is state that when something is positive, it rubs off on other people, and when negative vibes are around, then it rubs off on negative people. You understand? So it's all positive people that I know around here. Yeah. So everybody around there, they're all positive people. Yeah, man. Big up yourself. Yeah, man. Anything goes. Yeah. So he's one of those person that is positive. And, you know, like everybody else around here. You know what I mean? And right now, he's doing his thing. Yeah, he's an entertainer. Yeah, he's a dancehall reggae artist, and right now he's hot in Jamaica. Hot like hot bread. Yeah. Hot like hot bread. You know, he has a nice song out there called Greater Now that is, you know what I mean, making waves. Yeah, man. He's making waves. And you guys should check him out. Yeah, man. The song is called Greater Now. Look it up on YouTube. Greater Now by the Tall Boss. And his page is Damon Daly, or you can look at the Tall Boss. Yeah, Tall Boss Music. Yeah, man. But what I'm saying to you about the reason why I brought up the positive thing is this. I growing up, you know what I mean? The same attitude that exists with the people around where I'm from, Gordon Close, Shooters Hill, Bull Bay. To this day, it is the same attitude that is there. Yeah. So it means that even though, you know, these communities goes in batches, because the batch that I grew up with, maybe about 60% of them is all gone. Right? But the new batch there, the people that actually came in, or the kids that have grown up, has the same attitude. Yeah, the same attitude. Yeah, the same attitude of making positive impact. Positive impact. Yeah, they don't take up guns, they don't form gangs, they don't get into violence, they don't misbehave, they don't fight each other, they don't argue, cuss. Yeah, it's the same attitude and principle that still exists today. You understand what I'm saying? So, where did that come from? It came from generation upon generation upon generation. You come and you see that. So you have to pattern it and mimic it. And you have to be in line with it. Yeah. And if you get out of line, somebody will put you in line. Yeah. Yeah, man. That's the call for yourself. You see what I'm saying? So that is what I like about that, you know? And believe you me, people, it is easy to actually go on the bad side. It's easy to go on the bad side, especially when you're surrounded by it. Yeah. But you keep focus and you stick. Yeah, you keep focus and you stick to the good side. And the good thing about it is that once you put in the work and you work and you work and you work, result will come. And for years, the tall boss has been putting in the work. Yeah, and he's reaping the reward right now. Give thanks, my brother. Give thanks, my brother. Yeah, man, keep your thing. I'm proud of you, you know? I'm proud of you. Yeah, man, I'm proud of you. Yeah, man, I'm proud of everybody around here. Every single person. No lofters, no idlers. Great, positive people around here. And likewise, you know, if you are in a community that, prone to violence and crime, try to push forward positive people. Let them be positive role models. And when you see negative things, you let them know that other options do exist when you choose positivity, because then it will become contagious and people have no choice but to get in line with that. Yeah. But if you know, take sides and jump on negativity, then negativity will breed negative attitudes and vibes. And as a result of it, things get out of hand. Yeah, positivity. Yeah, man, this new generation well focused and the tall boss are bring a change. Great, my brother. Yeah, man. Yeah, greater change. Greater now. Yeah, greater now. You know what I mean? And that is the impact that you want to see. And I like the fact that, you know what I mean? You are actually including the people them with you. So your positive is being shared with them and they're embracing it and getting in line with it. And that's the positivity of sharing. And that's the positivity of getting people to get in line with positiveness rather than to do the alternative, to turn to negative. Proud of you, my brother. Really appreciate that, you know? Yeah, man. Thanks for joining Unscripted. Anything goes. Yeah, so remember, people, the Tall Boss music, greater now. You can actually get it on, what do you call it now? iTunes. Yeah. Yeah, you can actually get it on iTunes. So I want you to go on Apple iTunes and purchase the song, Greater Now. It's a good song. You know what I mean? Put it on your iPad and you play it in your car, play it in your house, share it with somebody, or purchase it for somebody. Yeah, and support the Tall Boss. It's a good thing. Yeah, it's the right thing. And he has the video now for that song is also out. So you can go on YouTube and you check it out and you see the song and you see the video that it is a positive song and a positive video. The Tall Boss, Greater Now. Yeah, man, straight up. Let's see what Sharon has to say. Love the song, Tall Boss. Yeah, man, something I can listen to if you know what I mean. Of course, yeah, man. We know what you mean, man. You know, I know you're a religious person. So you're not really too like the other side of it, but you like the positive songs. And this is a song that you and your family can listen to. Everybody, because it has a positive vibe and a positive energy. Yeah, man. Big up yourself, Veronica Darby. How you doing, girl? Thanks for joining. Unscripted, anything goes. Yeah, man. Veronica Darby is the Tall Boss mother. Yeah, very nice lady. I love that lady. I respect that lady. And that lady's been a hard-working lady from Heinwar. Yeah, you understand? She's a hard-working lady. So she's a positive role model for him as well as the community as a whole, or the neighborhood that we are from, positive role models. So he has no choice but to follow in line, or he'll be put in line. You understand? But nobody had to put him in line. He just knew that it's naturally innate in him and built into him. Yeah, to be positive. Yeah, man. Bless up yourself. Yeah, man. Straight up. And I respect that very much. Respect that. Delvin already. Yeah, man. Really conservative. Really conservative. Yeah, man. People must work hard to achieve things in life. And you put in the work, then results will come. And the tall boss has done that. My respect. Yeah, man. Manners and respect. Yeah, man, people. Unscripted. Anything goes. Yeah, man. Straight up. So, we're talking about what we're talking about? Ovarian cancer. Cancer week. Yeah, cancer week. Ovarian cancer. So it's a long lecture. So we might just skip out some of it just for time purposes. But ovarian cancer, like any cancer, is actually serious business, people. Serious business. This affects a whole bunch of people. Yeah, man. Ovarian cancer affects a whole bunch of people. So what is ovarian cancer? And just as it says, it's cancer of the ovaries. Yeah, the term ovarian cancer includes several different types of cancer. Yeah, it's uncontrolled division of abnormal cells that can form tumors. Yeah, that all arise from cells of the ovary. Yeah, most commonly tumors arise from the lining cells of the ovary. So all the cells that makes up the ovary, the ones that along the lines, yeah, they can actually form tumors, which leads to ovarian cancer, a whole bunch of different type of tumors. Yeah. So there are also less common forms. There's like major forms of what you call now ovarian cancers. These include what you call epithelial ovarian. That is from the cell on the surface of the ovary. You also have cells on the fallopian tubes, and you have cells on the lining of the abdomen structure of the ovaries. So those are the major tumors. So some of the tumors are what you call now low malignant tumors. These are microscopic small tumors, and they're not basically a threat, but some of them can tend to spread and become major cancer cells. So yeah, there's less common forms of what you call now cancer tumors that include germ cell tumors and what you call now sex cord stomach tumors. We don't want to get too much into terminologies, but in other words, you've got those bigger tumors that can now spread and become what do you call now malignant. Malignant. They can like the cells them they can what do you call now the cells them can multiply to become a bigger problem, which create ovarian cancer. And then you have the smaller one, which are benign, that those ones are localized cells that are not of the threat format to actually become a major issue. But in other words, like, you don't want to have any tumors. You don't want to have any tumors on your ovaries. Yeah. So there's several different form of cancers, classification of ovarian cancers. So first, let's look at what you call now epithelial ovarian cancer, and let's spell that out properly so you can actually look it up if you want. It's epithelial, epithelial ovarian cancer. This form of cancer now Um, yeah, man, big up yourself. Yeah, man, bless up, my brother, bless up. Yeah, man, bless up yourself, Patricia. Yeah, yeah, bless up yourself. Thanks for joining. All right, this form of cancer now, um, is a major form of cancer. It's a major form of cancer. It is generally thought of as one of three types of cancer that includes the ovary, the fallopian tube, and the primary lining of the ovary. All of these types are major types of cancer, and they're basically a big threat, straight up. Um, so the fourth form of cancer now is a common tumor cell type on the ovary. It's a common tumor cell type over it. It's called mucinous clear cells. All right. These cancer cells arise due to DNA change in cell that leads to development of cancer. So these terminologies are some big terminologies, but in other words, there's four forms of the cells, and three are basically critical, and one is, not that critical. The serous cell type is commonly is most common variety. So they're like clusters. It is now thought that many of these cancers actually come from the lining of the fallopian tube, and fewer of them from the cells on the surface of the ovary. So most of them are in the lining, and a few of them are on the surface. So you can't basically see it. You need a microscope to actually look to actually find them. Yeah. However, it is often hard to identify the source of these cancers when they are found at an advanced stage, which is very common. Yeah, man. Big up yourself, Desiree. Thanks for joining. Unscripted, anything goes. I love you, girl. Yeah, man. Cadet, Patricia, thanks for joining. Unscripted. Beverly Bellamy, thanks for joining. Unscripted, anything goes. Yeah. So, ovarian low malignant potential tumor. So these are low on the category scale, right? They're borderline tumors. They're not anything major. These are very small ones. So the ovarian tumor of low malignant potential, formerly referred to as borderline tumors, account for about 15% of all tumors. Yeah, 15%. They are most often serious, or they're very small tumor cells type. They often develop into large masses that may cause symptoms, but they only rarely metastasize. Yeah, that is spread to other areas. Yeah, often removal of these tumors, even at more advanced stage, it can be cured. So these ones are not high risk. They're very low risk, and they're easy to remove. Straight up. Yeah, man. And this information that I got is from the medicinenet.com. So you can go and check it out. Very detailed information and everything on ovarian cancer. Yeah, man, straight up. Germ cell tumors arise from the reproductive cells of the ovary. These tumors are uncommon and are seen most commonly in teens and young women. So the germ cell tumors are seen mostly in the small ones. They're mostly in teenagers and young ladies. This type of tumor include different categories. I don't want to get into the big terminology, but basically they're very small, and they don't develop into ovarian cancer, because these kids are young and they're just small little tiny little nibbits, like what you would see on these small things that you don't need to worry about. So the doctors will just send you in and then just remove those, before they become cancerous. So they're not really big threats. All right. Big up yourself, Sterling, my brother. Thanks for joining. Unscripted, anything goes. So there's what is known as stromal ovarian cancer. Stromal ovarian cancer. It's another category of ovarian tumor that is sex chordal tumor, stromal tumor. Let's state what it is about so that we don't go into too much terminology. It says these arise from supporting tissues within the ovary itself. So the tissues that are in the ovaries, the tissues that supports the ovaries, this is where it comes from. As with the germ tumors, these are uncommon. These cancers come from various types of cells within the ovaries. They are much less common than the big, huge tumors, that we mentioned earlier. Stromal ovarian cancers include, what they call granulosa, stromal tumor, and steroli, whatever tumor. So those words are not relevant to us, but we just want to make mention of them. All right. So let's get into some statistics. The statistics will paint the picture of how severe these cancers are. These ovarian cancer. Don't worry about the terminology. Just know that there's major categories of tumors that are in the lining of the ovaries and on the surface, and some are, not that detrimental, while the major ones are very detrimental. So what are the ovarian cancer statistics? So let's look at the statistics, and then you will see yourself in this. All right. It says, according to the National Cancer Institute, there are over 22,000 cases of ovarian cancer and over 14,000 deaths from the condition each year. So each year, 22,000 people diagnosed with ovarian cancer. Yeah, we're going to get into the symptoms and all of that. Yeah. So we just want to talk about what it is about. So we're going to get into the statistics, and we're going to get into the symptoms, the risk, and the surgeries. So, so let's get through this as quickly as possible. So let's look at each year, 22, it's a serious case, 22,000 cases of ovarian cancer. And each year, 14,000 deaths from condition of ovarian cancer each year. That's very high. Yeah. The vast majority of the cases are the I category types that we mentioned earlier. That are the stage 3. Those are people of the stage 3 categories. And we're going to talk about the categories or the stages that you could be in later. Meaning that the cancer has spread beyond the pelvic or the lymph nodes. Because remember we say that when it's malignant, right? Then the cells now start to split and start to double up and spread to other areas. So as a result of the stage 3 form of it, people dies from it each year, right? 14,000 people die from it. So it's a serious thing. Yeah, man. Sheldon, my brother, thanks for joining. Unscripted, anything goes. Yeah, man. This is due to the lack of definite symptoms. So you can have the ovarian cancer, you don't even feel nothing. Yeah, you can feel nothing if you have it. Yeah, it's a lack of definite symptoms. So you must be screened. Yeah, make sure you get tested and screened. Yeah, so there's no symptoms. So it's because of the lack of definite symptoms and signs at the early stage of the cancer. Yeah, around 1.3% of women will be diagnosed with cancer of the ovary at some point in life. 1.3% is a lot of people. Yeah, man. Straight up. That's a lot, you know. It's a small rate, but you know, it's a lot in when you look at the totality. Yeah. Yeah, man, Rose Clark, big up yourself. Yeah, yeah, big up yourself, girl. Yeah. Yeah, man. The medium age of diagnosis is 63. The median age of diagnosis is 63. However, approximately 25% of cases are diagnosed between 35 and 54. Yeah. So the actual age where a lot of, like, the median age where people are actually diagnosed is when you're a little bit older. That is what it said, 63. However, it says approximately 25% of the people are diagnosed between 35 and 54. So even at a younger age, people are still getting it. Yeah, yeah, serious number. Yeah. All right. And from the point of view of race, right? Caucasian women have the highest rate of diagnosis. So this affects all ethnic people. However, the highest rate are Caucasian women. A Caucasian. So if you know any of your Caucasian sisters, yeah, you tell them to get tested. You get tested too. Yeah, you get tested and tell them to get tested. Yeah, straight up. Yeah, straight up. Yeah, man, you get tested. Yeah. The incident rate for ovarian cancer have been declining slightly over the last 10 years in the US by about 1.9% per year. So what happened is that, I mean, people are actually getting tested. So each year, the actual rate of people now, you know, the actual rate of people actually getting ovarian cancer is going down by 1.9%. Straight up. The death rate has also fallen to 2.2%. So less people are dying. The rate is going down. Straight up. So I guess people are actually getting tested earlier and actually recognize, you know, all of these. Because remember, I told you that tumors have to develop first. And some of the tumors now, they double, and as a result, it turns into the ovarian cancer. So what happens is that people are getting tested early. So before the tumor becomes cancerous, they are being removed. So if they're being caught early, then it's easier to actually treat the problem or to sometimes eliminate the problem before the problems become to the point where you're gonna die from it. Yeah, man, that's good. Yeah. Early detection is the key. Yeah, Marcia, thanks for joining Unscripted Anything Goes. I love you, girl. Thanks for joining. I love you. Thanks for joining Unscripted Anything Goes. Straight up. Yeah, man. Yeah. So that's good. Yeah, it's clearly that's good that it's declining over the years. And that goes for education. And you see, the internet is a good source, you know. It's a good source to read and learn about all of these things. So you realize the significance and importance of you actually getting screened and tested. Yeah, for it. So more and more people are actually getting tested and getting treated. So hence, less people are dying from it. Yeah. It says, however, the 5-year average survival rate for all women diagnosed with ovarian cancer is 46.5%. So over 5 years, if you're diagnosed with the ovarian cancer, yeah, over 5 years, yeah, if you're diagnosed with it over 5 years, 46.5% of the people survive. It's a lot. That, I mean, what I mean is that a lot of people are dying. Yeah, a lot of people are dying. So once you reach the cancer state, portion of it, not just the small tumors, but where it now start to spread and rapidly double up in size, it becomes malign. You find malignant. You find say it no, it within 5 years, within 5 years, 45%, 0.5% of the people survive. But on the other hand, yeah, 55, what is it? 53.5 people dead. Yeah. Yeah. Are you a gynecologist? No. No, dear. No, dear. I'm actually quoting here. No, Delvin, not a gynecologist. No, I'm not a gynecologist. Delvin is just an information person. Yeah, I do this research and then come and give it to you. Because these are real issues that people must learn about and know about. Nobody talks about it. So Delvin take it upon myself to talk about it. Yeah, talk about real things that affect real people. Yeah, straight up. So, yeah. So I'm only quoting from the side here. Yeah, straight up. So this is because it's often found in an advanced state. So because people are not getting tested early to detect the tumors. Yeah, because they're not getting tested early to detect the tumors. When they're now diagnosed, they're at the stage 3 stage or stage 2 stage. I would say stage 2. Yeah, because if this is within 5 years, only 46.5% of the people that has the cancer die. So they may have been detected in stage 2 or in stage 3, and as a result of it, yeah, 46.5% survive and 53.5% dead. Yeah. So early detection is a good thing. At the tumor stage, when the small or the big ones are there, that before it reach cancerous, so it can be removed. Yeah, man, straight up, it's whopping. Yeah, don't get to the cancer stage part of it. Yeah. Real talk. Yeah, man, you have to do your test. Yeah. Oh, you do your test. Yeah, man, straight up, do your test, of course. Yeah, man, get your test done. Yeah, because it is, most of the time it's found in the late stages because nobody are getting tested. People just disregard it, Yeah, don't do that, people. Get your pap smear done and get your blood work done and everything done. Straight up. Yeah, straight up. Serious position. Yeah, man, let's see what Sheldon has to say. Well, another thing is we need to start to encourage our sisters and our families and members and friends to take serious and be supportive. Yeah, man, you're right about that, my brother. Yeah, you have to start. That's why we have these shows, to enlighten people of what we take for granted and what we're not doing, so that you can now actually look around you and actually make a difference to the people around you. You understand? Where you now start to remind people around you that, you know what? If you haven't gotten these tests done, go and get tested. Yeah, go and get tested. Straight up, if you haven't gotten these tests done, go and get tested. Straight up. And point them to lectures like this, or tell them to go and do the research and see the impact of what could result to them if they don't go and get tested. Yeah, because you don't want to lose anyone too soon. Yeah, when something, if it could have been caught early, yeah, it could actually eradicate the problem or allow you to live longer. Yeah, why would you want to reduce your longevity in life and shorten your lifespan when you could prevent it? That's why I go to the doctor every year and make sure I check every single thing. Everything I want to be checked. And so is my wife. And so should you. Yeah, man. Yeah, man. Don't worry, girl. Yeah, don't worry. Yeah, man. No problem. I love you. No problem. Same way. Yeah, man. Yeah. Yeah, man. So you have to actually encourage those around you, as Sheldon says, to go and get checked. Yeah, man. So if it says here that survival is also dependent on the type of care the patient receives. Yeah. Women suspected of having ovarian cancer should be referred to a gynecologist right away. Yeah. So you should be referred once the smear come back that you possibly could have a tumor or something pertaining to the ovarian cancer. You should be referred right away to a gynecologist, and they would refer you now to a gynecologist, oncologist, to be actually dealt with. These are physicians with special training. They have special training in this area. They have special training in the ovaries, the uterus, the cervical area, the vulva area, and the vagina. They all train to deal with cancers of the woman private part. All and everything, the womb, everything. These are specially trained people that that's their job. You understand? So you're in good hands. Yeah, you're in good hands. The best care will be given based upon your need, because each person, once you're diagnosed, your category could be different from somebody else's category. So they will now set you on a course to give you the best advice necessary for your treatment. Yeah, man. If a woman does not involve a doctor with the specialized training, in her case, then studies show that her survival is significantly worse. So if they don't put you over to a specialist, or you disregard what is being told to you, or you don't get checked, man, you are actually not getting the best care. So you will be in a worse state. You'll be in a worse state. So for this reason, every single woman with the disease or tumors, or has the ovarian cancer, every single one of you should be referred to a gynecologist, before she starts any treatment or surgery. So once your doctor, it comes back to your doctor that your smear has something negative associated with the vagina area, any form, whether it be the cervix, the uterus, the ovaries, the womb, anything in that area, you make sure that the doctor himself, your general practitioner, the physician, make sure he refers you right away to a gynecologist. As a matter of fact, every single woman must be seeing a gynecologist. Every single woman, if you're not seeing a gynecologist right now, make sure that your doctor refer you to a gynecologist. Because a pum doctor them, vagina doctor them, that is a very important part of your body. You should be getting the best care for that part of the body. The general practitioner himself can be responsible for everything else and to refer you elsewhere. But that is a constant place that needs special care and specialized people to actually look at it all the time. So let your doctor refer you to a gynecologist, and you actually go and get gynecological care. Listen to what Delvin tell you. So men, advise your wife to go and see a gynecologist right away. You understand? Go and see a gynecologist. Them specialize in that area. Their job is to keep your vagina healthy. So you go and see them and make sure that it is healthy. Make sure it is healthy. Not only that, anything that arises that is of concern, they will be able to actually see it right away and deal with it right away. Yes. Yeah, that is why they're there. So please, ladies, I beseech you to have a gynecologist. Go and see a gynecologist right away. Yeah, go and see a gynecologist right away. Yeah, man. Big up yourself, Selassie Punch, my brother. Thanks for joining. Unscripted, anything goes. So, what are ovarian cancer risk factors? What are the risk factors associated with ovarian cancer? All right, let's take a look at the risk. All right, risk factors are related to two major categories. It's menstrual cycle, yeah, the ovulation, and family history. Yeah. Yeah, so your menstrual cycle and family history. The more a woman ovulates, yeah, the more she have a cycle, yeah, over her lifetime, the higher her risk of ovarian cancer. So the more you menstruate, some of you women have menstruation 2 times a month. Yeah, something is wrong. If you're menstruating 2 times a month, something is wrong. Yeah, some of you ovulate for a week straight, like 2 weeks straight, 3 weeks straight. I know a woman who menstruates for over a month straight. Yeah, over a month straight. Yeah. And she thought that it was normal because then she'd menstruate for over a month and then she don't see it for like 2 months. Then she menstruate again for like a month and a half and then don't see it for 2 months. Something was wrong. You know what was wrong? Yeah. She had, what do you call it now? Fibroids growing on her fibroids growing on her what is it, uterus? Yeah. Yeah. She had fibroids. So yeah man. So she had to know, yeah, go and see the gynecologist who, after looking in depth in it now, realized it's the fibroid that is causing the bleeding. Yeah. And she was at a bad stage where the fibroids are causing some serious pains and she thinks it's cramps. But it's not cramps. So what she had to have is a hysterectomy to take the full womb out. Yeah, she had to take the full womb out. But she's okay now. She's okay now after taking the womb out. So these are serious things, people. Very serious things. So the major risk categories, the major risk are your menstrual cycle and your family history. Yeah. Thus, starting her period at a young age, ending her period, menopause, at a late age, and never getting pregnant, yeah, are all risk factors. It was once thought that infertility patients who underwent preparation for IVO, and that is ovarian stimulation for the vitral fertilization, for in vitro fertilization, were more at risk. But this has since been shown not to be the case in a large comprehensive review of the subject. Approximately 15% of ovarian cancers are generally related. Because of this, current guidelines suggest that all women with ovarian cancer should undergo what do you call now, a genes test. Yeah, to test your genes. Yeah. Yeah, I don't know what that entails. So, you know, you guys wanna, it's called a mutation. Yeah, I don't know what it means. So you guys can check that out. You don't have to know every terminology and definition. Yeah. It says all patients with ovarian cancer would ideally discuss the topic with your doctor. These genes mutations can affect males as well as females. So this is totally different because, you know, over time, right? Over time, you know, over time is this, right? Because we are now, we have different people in us. Yeah. Yeah, different people in us. What I mean by that is this. All right. That is why you can't have sex with your sister You cannot have sex with your cousin. I think you can't have sex with your sister, your cousin, and cousin. Yeah. Anything after that, you can't have sex. You can't have sex with like your fourth cousin, your third cousin, or fourth cousin. Because what happens is that the blood is so strong, yeah, that during that time, you can actually get, what do you call now? You can get sickness from the bloodline because it's too close and it crossed. So that's why you have people with Down syndrome. You can have people with like certain cancers can pass through because of that. So what happened is that after like the three or four, it mutates. Yeah. The gene mutate within that now to create a different what do you call it now? Strain. A different strain. different strain of gene. A different strain of genes. yeah. That is how it works, really. That is how it works. So every gene or every bloodline is not in you, even though it is in you. Yeah. Every bloodline that was ever in your gene pool is not in you, even though it is in you. It mutates and forms a new strain of bloodline. Yeah, I wonder if that makes sense. But I try my best to explain it. But that is the way it is. Yeah, that is the way it is. Yeah. Yeah, I wonder if it makes sense. But that is the way it is, though. It mutates. Yeah, so there's even mutation within human beings. Yeah, straight up. So all patients with ovarian cancer would ideally discuss the topic with their doctor. Discuss it with your doctor, right? Yeah. So we get already, yeah. So testing involves simple blood tests. It's a simple blood test to determine ovarian cancer. So you go to your doctor and they draw blood from you, and the blood is drawn, and then it's sent to the laboratory, and the result of the test now sent back to your family physician about the cancer. If they have any form of cancer, it will show up in the blood. So it's not like one time, but now everything them tests, like all prostate cancer, you can now check that. The doctor don't have to push their hands up in your butt anymore to feel if the cancer, if the prostate is swollen. Just like this now, the blood is sent to the laboratory, and the laboratory will come back to see if you have any cancers within the blood. Yeah, straight up. Yeah, straight up. Big up yourself, Karen Hamilton. Straight up. So it's a simple thing. You just go to your doctor, you get a blood test to check to see whether or not you have ovarian cancer. Yeah, man. Simple blood test. Yeah, man. So we don't want to get into all of that cancers about. Yeah. So we're gonna go down. So the Lynch syndrome, typically called no, we don't want to get into that either. Yep. So what are ovarian cancer symptoms and signs? So what are the symptoms and signs? And this is what a lot of you would probably want to know. What are the symptoms and the signs of ovarian cancer? All right. Let me go to the next page here. All right. So it says there, screening tests are used to test if a healthy population to test a healthy population to diagnose whether or not a disease at an early stage is there. It says, unfortunately, there are no good screening tests for ovarian cancer, despite extensive ongoing research. It says, imagine pelvic or abdominal ultrasound, X-rays, or CT scans. It says, and blood tests should not be used as a screen, as they are inaccurate and lead many women to surgery who do not need surgery. So even with the blood test, that's not even 100% accurate. You know, the blood test will probably show the signs that it's possible that you could have that now. And then they would actually go inside probably with a scope and scope it to make sure that and confirm that it is. It says diagnosis of ovarian cancer is often suspected based on symptoms and physical examination, and these are followed by imaging. All right, so your symptoms and your doctor physically examine you, and then they image you, like, you know, go in with the microscope and take pictures and look at it and see. It says the signs and symptoms when present are very vague. These can include your fatigue. You're fatigued a lot. Yeah, man, Carol Hamilton, big up yourself, girl. Yeah, so it says that you're fatigued a lot. So listen, watch out for these signs, you know. You're fatigued a lot. You're getting full quickly. Your belly full up quick. Yeah, man. Your abdomen swells. Your abdomen swells. Yeah, swelling of the abdomen. Your clothes suddenly not fitting. All of a sudden, you feel fat. Yeah, your legs start to swelling. Yeah, you change in bowel habits. Yeah, changing in bladder habits. Abdominal pain. And shortness of breath. So, do you have these symptoms? Let's read them again. Yep. So, if you have these symptoms, there are signs that you could have ovarian cancer, and you should be, you know, get the blood test done and have your doctor examine you, and if not, imaging to confirm whether or not you have it. So, these are the signs. You're fatigued. Are you fatigued a lot? Yep. Are you getting full quickly? Yeah, your belly full up quick. You feel like you're full. You don't eat the same amount, but you feel full. You have abdominal swelling. Yeah, your abdomen feels swollen. Yep. Yeah, suddenly your clothes not fitting. Your legs are swollen. Yep, swelling of the legs. Yeah, changing in bowel habits. No, you used to poo 3 or 4 times one time a day. Now you're pooing 3-4 times a day. Yep. Changing in bladder habits. You start to pee more often now. Yep. Abdominal pains. You're feeling a lot of pain in your stomach. Or you even have shortness of breath. Yeah, you even have shortness of breath. Do you have any of these, or all of these, or a combination of these? Get yourself checked. You could possibly have ovarian cancer or developing ovarian cancer. Yep, it says, as mentioned, these symptoms can be very subtle or vague. Yeah, as well as very common. This only makes diagnosing the disease much more difficult. Some studies suggest that the average patient with ovarian cancer sees up to 3 different doctors. Yeah, some patient sees up to 3 different doctors prior to obtaining a proper diagnosis. So you might feel wanting the doctor send you to this doctor. You might feel wanting the doctor send you to this doctor. Yeah, until you finally get around to actually diagnosing you with ovarian cancer. Often it's persistent if you don't persist, often it's the persistent of the patient that lead to the proper diagnosis. So you go to your doctor, you have abdomen pain, they give you some pill. Yeah. You're peeing too much, they're giving you some pill. You're shitting too much, they give you some pill. Yeah, you feel bloated, they give you some pill. They give you something just to get rid of you. But the problem still lies there. And because you're so persistent with it now, yep, they keep sending you until the right doctor suggests to you that this could be what you have. And as a result, it sent you to a gynecologist. You get screened, image, and all of a sudden, you have ovarian cancer. But don't let it get to that point. No, go and get the blood work done. Yeah, and go and see a gynecologist and get proper gynecological care. These things, it can actually be found quickly and dealt with quickly. Yeah, man. It says OLMPT, whatever that is, and some benign tumors can present with smaller symptoms. In addition, they are often seen as very large, massive tumors on the ovary. Often these masses are large enough to cause bloating, abdominal distension, constipation, or changes in bladder habits. Yeah, man, big up yourself, Karen. I love you, girl. Thanks for joining. Yeah. In more common ovarian types, the ones that we mentioned earlier, symptoms are similar. Sometimes, what do you call it now? It says granulosa cells, tumors, can occur with severe pain and blood in the belly from ruptured tumors. You understand? Blood in the belly from ruptured tumors. So look at your poo and look at your pee to see if there's blood coming from your poo, or you're peeing blood. Yeah, because some of the tumors could rupture in your stomach. So if you're feeling pain in your stomach, it could be a possibility that a tumor has ruptured. Yeah. These can often be confused with ruptures of pregnancy, as they tend to be found in women reproductive stage. Yeah. So be careful of all the pains that you feel in your belly, or you're passing blood outside of your normal cycle. Yeah. So watch them blood something there. Yeah. And anything that is abnormal, that is outside of your normal cycle, make sure you go see the gynecologist right away. Right away. Go and see the gynecologist. So how do healthcare professionals diagnose ovarian cancer? How they diagnose it? Okay. It says often vague symptoms eventually leads to clinical diagnosis, or one based on suspicion. So the doctor could suspicion, based upon the symptoms that you described earlier, the doctor could suspect that you have that. Yeah? And then they will send you to the laboratory to get the test done, and then imaging to confirm it. However, an accurate diagnosis requires some of the mass or the tumor be removed. So they'll go in and remove it. Yep, and then they'll do a biopsy of it to confirm that it is ovarian cancer. Often, high clinical suspicion can trigger and refer to a gynecologist. So yeah, so once they suspect in that area, now they'll go in and they'll remove part of the tumor that is there, and they send it to the lab to do a biopsy to confirm that it is ovarian cancer. Big up yourself, my brother Timothy Borland. Thanks for joining. Yeah, man. So various type of imaging studies can be used to diagnose the disease and lead to tissue sampling. Pelvic and abdominal ultrasound CT scans are most common done studies. So those are what they use to do the imaging. These often can give images that show masses in the abdomen and pelvic, fluids in the abdominal cavity, obstruction of the bowels or the kidneys, or disease in the chest or liver. So all of these things they check for, and many times this is all necessary to trigger or refer to a specialist, as the suspicion of ovarian cancer can be quite high. Yeah, man, straight up. So what they see on the CT scan and the images, they will know tell you that you have to go see the gynecologist or a specialist to actually look at it, to know, look at it in detail and tell you all about what they see, the gynecologist. Yeah, man. Yeah, man. Big up yourself, my brother Howard. Thanks for joining. Unscripted, anything goes. So, the blood work can be helpful as well. Yeah, the blood work can be helpful as well. So, the blood test is, you know, it will show elevated levels with ovarian cancer. Yeah, it will show elevated level that show that there's a suspicion of ovarian cancer. Yeah. If a postmenopausal woman has a mass or an elevated level, she has an extremely high risk of cancer. So when they look in the blood and see what is elevated, the CA-125, once they look in the blood and they see that that is elevated, then they know that there's a higher that there's a high risk for ovarian cancer. Yeah, so the blood test is pretty good. Yeah, straight up. So if the level is below 125, it's ordinary and inaccurate. They're saying here, whatever. I don't know. You have to don't leave that to the physician, to the gynecologist to determine those things. You know, but go and get the blood work done firstly to see whether or not something is elevated or beyond the normal scope, and as a result it needs to be referred for imaging and scanning. Straight up. Big up yourself, Valin. Thanks for joining. Unscripted, anything goes. I love you, girl. Yeah, man. No one should get this test done unless they are actually, if they have a mass. Okay, let's go back. All right, let's go back because we missed a step here. It says it is elevated by a large number of okay, blah 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 blah. Okay, forget about that. All right, so how is ovarian cancer staging determined? How are the staging determined? All right, so we're going to talk about the staging, and I want you to take note of this, please. It says staging is a process of classifying the tumors according to the extent to which it has spread in the body at the time of diagnosis. So once they diagnose you now, they look at now the stages that the tumor has spread to determine the different stage categories that you could quite possibly fall into. Okay? So these are the staging of ovarian cancer. Stage 1. Stage 1, it's limited to one or both of your ovaries. That is the first stage. Right? So the tumor is limited to just one of your ovary or both of your ovaries. So that is stage 1. Stage 2, it says, it is limited just to your pelvic. It's limited to your pelvic. Yep. Stage 3, it says the disease outside of the pelvic, but limited to the abdomen or the lymph nodes involvement, but not included inside of the liver. So yeah, so it didn't spread to all of the abdomen. It has spread to basically everywhere. You know, straight up. And stage 4, which is the last stage, disease is spread to the liver and outside of the abdomen. So it's inside and outside. Yeah, it's inside and outside. Yeah, inside of the abdomen and outside of the, so inside of the lining and outside of the lining. Yeah, straight up. It just gone. It's gone. Yeah, so you don't want that now. So the worst you probably want is there's a small tumor or there's a tumor that is on the ovary or both ovaries. That no, they probably could just remove those and treat you for those and you're good. But once it's spread to the pelvic or inside the pelvic or the abdomen, then you got problem, or the lymph nodes. Once it goes into the lymph node, now you're going dead. You're going dead once it goes into the lymph node. Yeah, straight up. Mm-hmm. Yeah, there's nothing they can do for that. They just give you a time limit and say you're going dead. You just give you some time for live and you're going dead. Yeah. So it says complete staging of the ovarian cancer include hysterectomy, removal of the ovaries, the tubes, removal of the ovaries, the tubes, the pelvic or the lymph nodes, biopsy or dissection, biopsy of the omentum or the large fatty tissues structure that provides support to the abdomen organs, all of that stuff, so basically they completely go through every single part of inside the abdomen, to determine, check every single thing in there image wise to determine how far the tumor might spread, to see this and classify in one of those stages. Straight up, it says ovarian cancer staging is determined surgically unless it's stage 4. So if it is found within reason before it get to stage 4, they can actually surgically remove the tumors. Yeah, they can surgically remove the tumors. Yeah, they can surgically remove the tumors. If it is in stage 4 now, or very advanced stage 3, then often this is proven with biopsy. They have to use now the biopsy to prove it, and that is at that stage, and you have to start chemotherapy right away. So you use chemotherapy now to shrink the tumor, and then they will do the surgery. So if the chemotherapy is able to shrink the tumor in the late stage 3 or possibly 4, then they can actually do the surgery to then remove it. But when it's that big, or it's at that advanced stage, you just can't go in and cut it out. They have to do the chemotherapy first, according to this. Yeah, man, straight up. Yeah, man. I've learned about this to see where you are learning about this too. Yeah, man, straight up. It says if the disease is not obviously stage 4, then aggressive surgical staging and debulking often is considered. So they try to cut it down. Cut it down. This decision is based on the health of the patient, as well as the judgment of the surgeon as to the chance of achieving an optimal debulking of it. Straight up. Alright? Straight up. Let's go through this as quickly as possible and wrap this up. Alright? So let's go through it. It says, what is the treatment for ovarian cancer? What is the treatment for it? So basically, surgery and chemotherapy. And that is actually determined by the gynecologist, oncologist. So there's two things, surgery and chemotherapy. And we discussed that earlier. Straight up. The surgical treatment is used for both staging and debulking. Staging is determination of the extent of which as the cancer has spread into the body. Debulking is the removal of much of the tumor as possible. If one imagines a handful of wet sand thrown on the ground, you will see a small pile and a bigger pile. So they have to now determine which is best. If a combination of both or just one. And if it's just the removal of it is needed by the surgery, because it is small enough to do that, then they'll remove it. But if it's too big to just remove it, then they'll do the chemotherapy to actually shrink it and then remove it. Straight up. Yeah, man. Straight up. Straight up. Yeah, man, people. So how you guys doing? You good? Yeah. So let's go into a little bit about the chemotherapy. Yeah, it says any patient healthy enough to tolerate chemotherapy will often benefit greatly from the use of it. The drug is used in the ovarian cancer. The drugs used in the ovarian cancer tends to have fewer side effects and thus are easier to tolerate than many other chemotherapy drugs. Currently, there are 2 ways to give chemotherapy to ovarian cancer patients. Traditionally, it's given into the veins. So they insert the chemotherapy into your vein. It's when initially diagnosed, the usual first-line approach is to give a combination of platinum drugs and toxin drugs, such as blah blah blah, whatever. We don't need to even know that. Another way to give the chemotherapy is to place it directly into the abdomen. In many studies, intrapersonal administration has been shown to significantly increase the survival. This is most often used in optimal debunking. All right, so whatever that is, they intravenously insert the chemotherapy through your veins, and this now goes in and shrink the tumor. Shrink the tumor now, and when the tumor is shrink based upon the chemotherapy, then they go to the surgical portion of it and remove the amount that is left. Yeah. All right. So you guys can read up about the treatment, more of the therapy aspect of it. But let's go down to it says, what is the survival rate and prognosis of ovarian cancer? Let's look at the survival rate here. It says if you have the epithelial ovarian cancer, if you have that one, which is the most deadly form of ovarian cancer, it says approximately 80% of patients will eventually die from it. 80%. So if you have the more advanced state of ovarian cancer, 80% of you is going to die from it. You see why early detection is necessary? If you wait too long before getting screened and diagnosed with the problem of ovarian cancer, if you let it get to the stage of stage 3 or 4, 80% of you are actually going to die from it. Yeah, man. So it says, however, survival in the short term is quite good. So in the short term, they can actually allow you to live. But long term, it says, you can live many years, but long term, it is going to kill you. However, with additional chemotherapy, the survival of ovarian cancer has been significantly extended. So with the chemotherapy, you can actually, live a little longer by doing the chemotherapy. Yeah. But if you wait too long to be diagnosed, 80% of you are going to die. According to studies, if patient undergoes optimal debulking following by chemotherapy, then they have a greater than 50% chance of still be alive in 6 years. You see that? Yeah. Remember we said earlier, you know? Yeah. Remember we said that earlier, that 53.5% of people dead within 5 years. Dead within 5 years. Yeah. After fully being diagnosed with ovarian cancer. 53.5%. But it says here, they can actually extend your life a little longer, yeah, if you undergo the chemotherapy and the debulking. Yeah, your chances are, 50%. You have a 50% chance to be alive in 6 years. Yeah, so you can get an additional year added onto it. Yeah, it is quite good considering that it is in the advanced stage. It is quite good considering you're in the advanced stage. Yeah. However, early screening is very important. Early screening is very important. You get early screening, then you don't have to take that risk of it developing into ovarian cancer. You can easily get the small tumors removed early and get them out of the problem, out of the way, and constantly getting screened, getting tested, so that if any new ones arises, you get rid of them as quickly as possible at a small early stage, rather than to go in an advanced stage where now, your survival rate greatly diminish because you take too long to go and get diagnosed. Yeah, man, straight up. It is also possible to prevent ovarian cancer. It is possible to prevent ovarian cancer. It is possible. It says there. No, it's not possible. Okay, let's put it this way. Is it possible to prevent ovarian cancer? There is no way to truly prevent ovarian cancer. It is not possible. You don't know. There's no way. Eat healthy eating, I would say, and all of that, and the luck that it's not in your gene pool. Yeah, it's just luck and chance. It says there is no way to prevent ovarian cancer. One would think that the removal of the fallopian tubes and ovaries would prevent the disease, but it is not always the case. It's not always the case. However, there are many ways to significantly reduce the risk. All right? So we're going to get into the ways that you can reduce the risk now. It says here, if a woman takes birth control pills for more than 10 years, listen carefully now. If a woman takes birth control pills for more than 10 years, then her risk of ovarian cancer drops significantly. What a thing. If a woman takes birth control pills for more than 10 years, then her risk of ovarian cancer drops significantly. And that it says here, I never write it. It was on here. But with you taking the birth control pills for more than 10 years, your risk drops significantly. But however, from what we learned yesterday, that could also make your risk go up for cervical cancer. It would have the opposite effect for cervical cancer. But with this ovarian cancer now, the birth control now would actually reduce your risk significantly. See, it says also here, if you have tube ligation, that is where cut your tubes and you or tie your tubes, whatever. If you have tube ligation, the tube ligation is the cutting of the tube and then you staple it. Yeah. If you have tube ligation has long been known to decrease the risk of ovarian cancer. So if you cut the tubes and you tie it, it greatly decreases your risk of ovarian cancer. It says recently, removal of the entire tube has been shown to further decrease the risk. So if you take out the tubes them fully and totally, you still reduce your risk. Yeah, man. So this procedure can be considered by any woman considering tube ligation to actually just take it out. Just get rid of them. Yeah, get rid of them. So if you already have your lot of kids and you know you don't want no more pitney, yeah, just take out the tube them. Yeah, man, cut them out. Yeah, and that will greatly reduce your risk of ovarian cancer. The removal of the ovaries does decrease the risk of cancer, but at the cost of increasing death due to heart disease and other causes. So taking out the tubes, taking out it says taking out the ovaries, right? It does reduce your risk of ovarian cancer, yes. Yeah, but it also increase, yeah, but at the cost of increasing death due to heart disease and other causes. So you can develop other risk of other things if you take the ovaries out. It says currently this procedure is often safe for a specific situation. You know what I mean? Like genetic risk, family history, if you know it's in your family and all of these things, or it's very high prominently in your family, you know, in your genetics, like your sister have it, your mother did have it, her mother did have it. Yeah, you know you're at a high risk. So, you know, yeah, in that case now, then they would do that surgery to actually take the ovaries out. But they do it for patients between age 60 to 65 years of age. It's not used in the general population until recently. Women, yeah, sorry, forget about that. Yeah, straight up. All right. So let's get back over here now to how do you cope with ovarian cancer? And this is the last portion of it. We're going to talk about how to cope with ovarian cancer. Yep. It says diagnosis of the cancer is often accompanied by emotional side effects or anxiety. So nobody wants to hear that they have cancer. Nobody wants to, especially you women. You don't want to go into the doctor and hear that you have ovarian cancer. Instantly, you might get emotional. You know what I mean? You take it onto yourself. You get anxious about it. You feel sad about it. You know what I mean? There's a lot of fear involved. So, it's not an easy thing to hear that you have ovarian cancer. Yeah. So a lot of emotional side effects and anxiety occurs. Fear and even depression. You might feel, it might send you to a state where you say, okay, no, I have ovarian cancer. You only have 5 years to live. You know what I mean? What do I do? All these things, it might lead you into depression. So it says, just as the treatment are designed to help fight the cancer growth and spread, self-care and support measures to help one handle emotional aspect of the diagnosis can be extremely valuable. So now you need to make sure that you surround yourself with a good support system that can help you deal with it. Get some counseling, get people that has your best interest at heart and can bring positive energy around you. You know what I mean? Many hospitals and cancer treatment center offers cancer support groups and counseling services to help manage your emotional side effects from the cancer and from the treatment that you're going to receive. Yeah, so take advantage of those support systems that they have in these cancer center and get the help that you need to help you on the emotional level cope with the fact that you do have it. You know what I mean? So as of today, don't let it get to this point of where you get to ovarian cancer to find out you have a short span to live. Go and get tested, and hopefully you're in the early stages so that you can actually get those what do you call it now? Get it removed as soon as possible. Those tumors, get those tumors removed as soon as possible so that you don't have to worry about it. But if it gets to that point where you're diagnosed with it, try to get the support, help from the cancer center. Get your family to support you and get some counseling to help you deal with it. From these hospital and treatment center. And they also have tip lines that you can call to get the help. Or if you need any help, call Delvin. Call Delvin. Send me a message. I'll talk to you. You know what I mean? I'll talk to you. I'll try to encourage you. You know what I mean? Yeah, man, that's why we're here. To lean on each other's shoulder. Yeah, man, people. So that is the lecture for tonight, ovarian cancer. It's very long, but at least we got through it. And that's the main thing. We want to give people positive information so that they can make informed decision about their life. That they don't shorten their life, but to get proper treatment and tests done at an early stage so that they don't have to worry about it, get to the cancerous stage of it. Yeah, man. So thanks for joining tonight, and I hope you enjoyed the information. Tomorrow, we're going to be talking about prostate cancer. Join me tomorrow for prostate cancer. So, remember, we're here at 7 o'clock tomorrow. So remember to embrace conservative values, and because we don't have badges nor guns, therefore, we must support the police. We must support our police. So until tomorrow at 7 o'clock, Delvin is saying, I love you people. Bye-bye.